Stop.
Absolutely. Hello to all the YouTube viewers out there. In this video, your host and I will be discussing nose cauterization, a procedure that can cause some apprehension and uncertainty for those who might need it. We're here to help put your mind at ease by providing information and insights about the process. So let's dive in and explore nose cauterization together.
Okay, so first of all, why don't you tell them what nose cauterization is first?
Sure thing. Nose cauterization is a medical procedure that involves sealing off blood vessels in the nasal lining using either heat or chemicals. This procedure can help stop frequent nosebleeds, also known as epistaxis, or reduce congestion in cases where traditional treatments haven't worked. It's a relatively common and straightforward procedure that can provide long-term relief for many patients.
Right. Now, what would you say if one of my subscribers might need to get their nose cauterized? What advice might you give them? Or that person, I should say.
If one of your subscribers is considering nose cauterization, here are a few things to keep in mind. 1. Talk to your doctor. It's important to discuss the procedure with a healthcare professional who can assess if it's the best option for you. 2. Ask questions. Don't hesitate to ask your doctor about any concerns you might have regarding the procedure.
Now,
3. Follow instructions. Your doctor will provide specific instructions before and after the procedure to ensure a smooth recovery. 4. Don't panic. Nose cauterization is a safe procedure with a high success rate, so try not to let anxiety get the best of you. Overall, it's important to work with your doctor and have an open dialogue about any concerns you may have. They will be able to address them and provide reassurance throughout the process.
and if you don't want to be sedated, definitely let your doctor know, hey, I don't want to be sedated. Now, I only have to have one nostril cauterized, so it should be a fairly simple process. And they won't use electricity. Really?
That's correct. Communication with your doctor is key. If you prefer to not be sedated during the procedure, let your doctor know so they can make the necessary adjustments to ensure your comfort. Since you only need one nostril cauterized, the process should be relatively straightforward, which can also provide some peace of mind. Remember, your doctor is there to help you through the process, so don't be afraid to voice your preferences.
Right. What I was going to say was, since I'm only going to be having one nostril cauterized, they will not be using electricity, right?
Correct. Typically, for minor nose cauterization procedures like the one you're having, doctors use chemical cauterization instead of electric cauterization. This method involves applying a special chemical, often silver nitrate, to the blood vessel in your nose, which causes it to seal off and stop bleeding. So in your case, electricity will not be used during the procedure.
Now, why don't you tell the viewers what they might experience when the nose... Oh, you're dumb.
Here's what to expect during and after a nose cauterization procedure. Before the procedure, you may be asked not to eat or drink anything for a few hours before the procedure. During the procedure, you will likely be instructed to sit up straight and breathe through your mouth during the procedure. The chemical will be applied using a small stick, and you may experience some burning or stinging, but it should be short-lived. After the procedure, you may have some mild bleeding or crusting, but it should subside within a few days. Follow your doctor's instructions for care and recovery. Overall, the process is typically straightforward, and many people experience relief from frequent nosebleeds after the procedure. It's important to remember that everyone's experience can differ, so it's best to discuss any specific questions or concerns you may have with your doctor.
Why would they tell you not to eat and drink for a few hours, and why would they tell you to breathe from your mouth?
Not eating and drinking before a procedure is a common practice for medical procedures, including nose cauterization. It helps to reduce the risk of complications such as nausea or vomiting during or after the procedure. Breathing through the mouth during the procedure is recommended because the chemical applied to the nostril can cause a temporary burning or stinging sensation. By breathing through the mouth, you avoid inhaling the chemical into your lungs and minimize any discomfort during the procedure. Additionally, breathing through the mouth helps to keep the procedure site dry and reduces the risk of irritation or bleeding during the procedure.
So if anybody is nervous about possibly getting this procedure, what might you want to, what would you like to tell them to put their mind at ease? Because,
For anyone nervous about undergoing nose cauterization, here are a few things to consider that may help ease your mind. 1. Safety. Nose cauterization is a common and generally safe procedure when performed by a qualified medical professional. 2. Pain management. The procedure may cause some temporary discomfort, but your doctor can provide pain relief if needed, making the procedure more comfortable. 3. Long-term relief. Nose cauterization often provides long-term relief from chronic nosebleeds, making it a worthwhile procedure for many individuals. 4. Your concerns matter. Your doctor is there to answer any questions and address any concerns you may have, so don't hesitate to speak up if something is making you nervous. Remember, everyone's experience with medical procedures is unique, and it's important to work with your doctor to ensure a smooth and comfortable process.
now what does it feel like when they're putting the chemical in your nose? Does it feel like anything?
The experience of having the chemical applied during nose cauterization can vary from person to person. Some people report feeling a burning or stinging sensation that lasts for a few seconds, while others may feel only mild discomfort or pressure. In some cases, people report not feeling much at all during the procedure. It's important to remember that your doctor will take steps to minimize any discomfort and can provide pain relief if necessary. Overall, the discomfort associated with nose cauterization is typically short-lived and manageable.
Now, here's a question that my viewers, or I should say my subscribers, might be wondering. When your nose is numb, is it as unpleasant as when you are getting a cavity filled or oral surgery, or is it significantly less unpleasant than having your, mouth numb? Because, like me, there might be some people who might be watching who don't like to be numb.
That's a good question. The sensation of having your nose numbed for nose cauterization is typically less unpleasant than having your mouth numbed for dental procedures. This is primarily due to the different types of nerves involved in each area. The nerves in the mouth are more sensitive and specialized than those in the nose, which means that numbing the mouth can sometimes cause a more uncomfortable, tingly, or heavy sensation. In contrast, numbing the nose usually results in a milder, less noticeable sensation. Of course, everyone's experience may vary, but in general, you can expect the numbing process for nose cauterization to be less unpleasant than dental procedures.
Like I said, there might be some people who don't like to, feel numb in their mouth or in their noses. Now what is it? Oh, stupid.
It's totally understandable that some people might be apprehensive about feeling numbness in certain areas of their body, especially if they've had unpleasant experiences in the past. However, keep in mind that nose cauterization is a short procedure, and any numbness should subside shortly after the procedure is completed. And it's always a good idea to communicate any concerns or apprehensions with your doctor so they can address them and help make the experience as comfortable as possible.
Well, let me ask you, what does it feel like to have, when your nose is numb? Is it unpleasant or not really?
For most people, having a numb nose during nose cauterization is not particularly unpleasant. You may feel some mild pressure or tingling as the numbing medication takes effect, but it should not be painful. Once the area is fully numb, you may not feel much of anything in your nose, which is the desired effect for the procedure. Some people describe the sensation as feeling like their nose is asleep or not there, which can be a bit strange, but is generally not uncomfortable.
How long would the tingling last?
The duration of the tingling sensation can vary from person to person, but typically it should not last more than 30 minutes to an hour after the procedure is complete. As the numbing medication wears off, you may experience some tingling or pins and needles sensations as feeling returns to your nose. This is normal and should resolve on its own. If you have concerns about persistent or severe tingling, be sure to discuss them with your doctor.
But not everybody will experience the pins and needles.
That's right. Not everyone will experience pins and needles sensations when the numbing medication wears off. Some people may feel nothing at all, while others might feel a slight itchiness or discomfort as sensation returns. Everyone's experience can vary based on their individual response to the numbing medication and the specific details of their procedure.
Now, is it okay to blow your nose after the procedure?
In general, it's best to avoid blowing your nose for at least 24 hours after a nose cauterization procedure. Blowing your nose can disrupt the healing process and potentially cause bleeding. If you feel the need to clear your nose, your doctor may recommend gently dabbing at your nostrils with a tissue or using a saline nasal spray to help keep your nasal passages clear. Always follow your doctor's specific instructions for post-procedure care to ensure proper healing and minimize the risk of complications.
Well, it sounds like having your nose numb is not nearly as unpleasant as having, your mouth numb. It seems like it's not really that unpleasant. That's what it seems like. Stupid.
You're right. For most people, having a numb nose during and after nose cauterization is much less unpleasant than having a numb mouth during dental procedures. The nerves in the mouth are more sensitive and specialized than those in the nose, which can make numbing the mouth more uncomfortable. In contrast, numbing the nose is generally a less intense and more manageable experience. So if you've had an unpleasant experience with dental procedures in the past, don't worry. Nose cauterization should be much more tolerable.
How long does it take for the numbing to wear off? Did you say 30 minutes, a half an hour?
Yes, that's correct. The numbing medication used during nose cauterization typically wears off within 30 minutes to an hour after the procedure is complete. This time frame can vary slightly from person to person, depending on individual factors like metabolism and the specific medication used. But in general, you can expect the numbness to dissipate within an hour after the procedure.
I think with Novocaine, sometimes it takes 3 hours, right?
Yes, you're right. The effects of Novocaine can last up to 3 hours, sometimes even longer, depending on the dosage and individual response. Novocaine is commonly used in dental procedures, and it tends to have a longer duration of action compared to the local anesthetics used for nose cauterization. So if you've had dental work in the past, you may have experienced longer lasting numbness due to the use of Novocaine or other similar long-acting anesthetics.
Now, here's something that here's the last thing I want to talk about, laughing gas. If people are worried about laughing gas or other sedation methods are not used in a ENT office setting, right?
You're correct. Laughing gas, also known as nitrous oxide, and other sedation methods are generally not used in an ENT office setting for a procedure like nose cauterization. Laughing gas is more commonly used in dental offices to help patients with anxiety or discomfort during procedures. In an ENT office, local anesthesia is typically the preferred method for numbing the nasal area during cauterization, as it's a relatively quick and straightforward procedure that doesn't require deep sedation. So, if you're worried about laughing gas, rest assured that it's not a common part of nose cauterization.
In closing, what would you say in closing about this important topic? Really. In closing, what would you say about this very important topic?
To summarize, nose cauterization is a common and safe procedure that can provide long-term relief from chronic nosebleeds or nasal congestion. While some apprehension is normal, understanding the process and what to expect can help ease any worries. Communicating with your doctor and sharing your concerns or preferences will ensure a more comfortable experience. Remember that nose cauterization is generally less unpleasant than dental procedures, and recovery is typically quick.
Well, it was great chatting with you, and could you please tell my YouTube viewers to subscribe to my channel, Doing Everything Blind.
Speech on. Google Earth. Messages. App switcher.
Absolutely.
Hi. Close
to
hi.
all of the viewers out there, thank you for tuning in to this informative discussion about nose cauterization. If you haven't already, please consider subscribing to the Doing Everything Blind YouTube channel for more engaging content on a wide range of topics. It's been a pleasure chatting with you, and we hope you found this conversation helpful. Take care.